Hi, I'm Dr. William O'Connor. I have a private practice in Vacaville, California for 26 years. I've been studying and making a specialty out of treating back pain and neck pain. I want to talk about whiplash real quick here, and I want to give you an understanding of what whiplash is and why it is so painful, and how you can relieve that pain and restore your range of motion. When a person has a whiplash, it's a very violent event in which usually you're hit from behind, and it's as if you're in a rocket sled, and suddenly you're slouching, and suddenly a rocket pushes you forward in a split second at an amazingly high rate of speed. What that does is, if your head is bent, it bends it more. Then you're stopped very suddenly when you hit something in front of you, or the brakes are applied, or when you are hit, your chassis of your car goes forward, and then instantly the chassis recoils and your seatbelt grabs you and pulls you back. So you're shot forward like a rocket sled, and then suddenly you're stopped, and even jerked backwards, but your head keeps going. And as it goes forward, there's a major weight-bearing flexion force put on your discs at the upper part of your thorax. It can happen in the back, but at the base of the neck is the most common site. What happens is that as that weight-bearing flexion force pushes the disc out, the piece goes posteriorly towards the back, and it gets hung up, and it stops you from ever straightening up or looking over one or the other shoulders. If you have a whiplash, and one of the problems is you can no longer look over your shoulder, one side or the other, and you have trouble straightening up without pain, or when you rest like this and your neck goes forward and bends forward, you get a lot more pain. Probably the probability is that you've put out a disc. And unless that piece of disc material is put back into the center, you'll eventually not be able to do it, because you can't move to the left because there's a piece of disc material stuck there, and it prevents you from actually straightening up or even turning to that side. That's very characteristic of the piece of disc material being displaced and locked up. My technique, called the O'Connor technique, and it's on the website called Making Your Bad Back Better, www.backachemd.com or www.backpainoconnor.com. Go there. It'll show you how you can test whether that is the case, that you have a piece of disc material lodged posteriorly and preventing your normal range of motion, and it can give you a solution. If you can't take the time to do that and you want to come and see me, I'll be glad to do that test for you and demonstrate to you that you have put a piece of disc material out, and I know how to put it back in. So I encourage you to go to the website or look me up, Vacaville, California. I'm an expert at treating whiplash. Thank you.